Imagine a world where everyone is safe, liberated, and thriving. That's the vision of Women Helping Women. And today we're joined by Kristen Trimplin, the CEO of Women Helping Women, to discuss how they are preventing gender-based violence, empowering all survivors, and creating real change. Kristen, thanks for being here.
It's lovely to be here. Thank you.
Absolutely. For someone who may not be familiar with Women Helping Women, tell us about your core mission.
Yeah, the core mission is focused, and we've believed in it for over 51 years. And it is simply to prevent gender-based violence and empower all survivors.
And gender-based violence and intimate partner violence are increasingly recognized as critical public health issues. From Women's Helping Women's perspective, what are the most significant health consequences from all of this?
Well, we're very clear, as you said, gender-based violence is a public health epidemic. So when we're at epidemic levels, we have to have real concerns about the health impacts. So the bottom line is, first off, we have trauma.
Yeah.
Right? And so it's from the immediate first step of victimization, and it can be long-lasting because the body keeps the score.
Right.
So when victimization first occurs, we're seeing increasingly physical injuries, strangulation, which within seconds can go to lack of oxygen in the brain, and so we're seeing brain injuries, all the way then to more intermediate and long-term impacts. So imagine if you have trauma and you've had victimization, you're going to see an increase in your stress levels, and you have stress, and you have stress, and you have stress.
Right.
So now we're going to see increases in cardiovascular health. We're going to see increases with incidence of stroke. We're going to see incidents of increased trauma with reproductive health. And in addition to that, that's the body, right? We can see that.
Yeah.
That's the inside. And then there's the whole space around mental health and well-being, and the trauma that continues as people continue on with their lives.
And we appreciate all that Women Helping Women is doing, because these are the issues that a lot of people don't want to talk about, right?
Yeah.
But you are doing that. And what kind of community support is most valuable, would you say, for Women Helping Women?
Well, as you said, a lot of people don't want to talk about this, right?
Yeah.
And that's the nature of violence. Violence, the entire operating system behind that is power and control.
Yeah.
So if I want to exude power and control, I'm going to say, don't tell anyone.
Yeah.
I'm going to say, no one's going to believe you. I'm going to isolate you from family and friends and resources. So essentially, the biggest thing that we need from the region, I could say money, I could say volunteering, that's always going to be true.
Right.
But in the nature of how to deal with that epidemic of gender-based violence is a very powerful statement to survivors.
And it really does take everyone working together. What are some of the community level strategies that Women Helping Women advocates for?
Boots on the ground.
Yeah.
I believe you. It's not your fault. There's help available. Because it's an epidemic, our coworkers, our friends, our neighbors, our family members have experienced this and are experiencing this. So when they disclose that to us, strategy, we can talk macro strategies all day long,
right,
but everyone's looking for that thing they can do immediately, and it's a powerful statement of I believe you, and it is not your fault.
What about some of the challenges that Women Helping Women is facing right now? Tell us about that, expound on that a little bit.
Well, that's a complicated question right now. So the challenges that Women Helping Women has always faced is what survivors have always faced in the region. We serve 5 counties, and that is because we're in an epidemic. Year over year over year, we are seeing more and more gender-based violence. Last year, we served about 8,500 survivors. Wow. We did about 36,000 responses in the community around crisis intervention. So in order to do that work, you need funding.
Absolutely.
And so the challenge right now, and honestly, we don't have clear vision on this, is if we're going to continue to have federal funding. Serving survivors is not political. It is human. It is bipartisan. It is for the public sector, the private sector, and the government sector to come together and say, we are going to serve and lift up and support those who've had crimes committed against them. So the challenges we're facing right now, in addition to an epidemic of gender-based violence, is, are we going to be able to continue to provide those services in this climate?
And there are some misconceptions about women helping women. What are some of those?
I would say the misconceptions are that we only serve one type of survivor and that it's women. That's not true. Our mission statement is empower all survivors. So we absolutely serve men. We don't care how people identify. You say you're a survivor, we believe you. We show up 24/7 and we're gonna support you.
And recognizing that this violence has roots in social determinants of health, such as economic equality and lack of access to resources, how does Women Helping Women address the underlying factors here?
Well, one of the ways, you know, we are definitely, when you respond to a community 36,000 times in a year with rapid response, you are in a state of triage.
Right.
So I have to acknowledge that. To add layers to when you're triaging, we show up 24/7 to 26 hospitals. We show up 24/7 in answering the hotline 20,000 times last year. We show up 24/7 when there's a 911 call and we're on scene with law enforcement. So there is that element of triage, but then we try to get to those underlying issues.
Right.
And survivors, fundamentally, when another person chooses, and it is a choice, chooses to commit a crime against them, survivors bear that economic burden. That's why our agency last year allocated rapidly over $900,000 to survivors. When they couldn't afford to get their locks changed, when they couldn't afford the medical bills, when they couldn't afford the car repairs because of what the abuser did to damage their car to get to work, when they couldn't afford childcare, when they couldn't afford to keep the lights on or to stay in their apartments or homes, we allocated $900,000 to help with some of that. You know, I'm not going to say economic sustainability because that's not where we're at, but I would say with some of that economic mobilization and triaging.
Well, Kristen, thanks for being here, for letting us know about your most impactful work at Women Helping Women.
Thank you.
We appreciate it.
Thank you.